Hello everyone, welcome again to the classroom. This video is the second part of the short series where we introduce to you the commonly encountered medications used during an emergency. Are you familiar with the medications in the crash cart or resuscitation trolley? It is important for us to know what are the medications available, their indications, and how we use them. These are the medications that we will discuss about today. If you have not watched the first video, do click on the link at the description below. First, we will talk about sodium bicarbonate. Sodium bicarbonate is used for patients with metabolic acidosis and hyperkalemia. 1 milliliter of this vial contains 1 millimole of sodium bicarbonate. In metabolic acidosis, sodium bicarbonate can be given at a dose of 2 to 5 millimole per kilogram over 4 to 8 hours depending on the severity of acidosis. In hyperkalemia, 50 millimole of IV sodium bicarbonate can be given over 5 minutes. Be sure never to mix sodium bicarbonate with calcium as they may precipitate. Hypocalcemia can be dangerous, potentially causing neuromuscular or cardiac manifestations such as seizure and tetany. 1 vial of 10 ml calcium gluconate contains 90 mg or 2.25 millimole of elemental calcium. Intravenous calcium bolus can be given at 100 to 200 mg of elemental calcium, which is about 1 to 2 vials over 20 minutes. After that, infusion of calcium gluconate may be started at 0.5 mg per kilogram per hour. Remember to monitor serum calcium levels every 4 to 6 hourly to adjust the infusion rate. Calcium gluconate is also used to protect cardiomyocytes and prevent the development of potentially lethal arrhythmia. In hyperkalemia, 1 vial can be given over 10 minutes. Magnesium is the drug of choice for torsade de Pouin and hypomagnesemia. Magnesium sulphate can be given at a dose of 1 to 2 grams slow bolus over 30 to 60 minutes. Hypoglycemia is a common cause of drop in conscious level which can be easily corrected. IV dextrose 50% is commonly used. 50 ml can be given to reverse hypoglycemia. The dose can be repeated while looking for the cause and until the sugar level is stable. Naloxone is used for the reversal of opioid overdose, especially when respiratory depression occur. An initial dose of 0.4 mg to 2 mg of naloxone may be given intravenously and if required, this can be repeated at 2 to 3 minute intervals. Lastly, Flumazenil acts as an antidote to benzodiazepines, for example diazepam and lorazepam. It is used in benzodiazepine overdose and as a reversal of anesthesia with benzodiazepine, especially when patient suffers from respiratory depression. Initially, Flumazenil can be administered at 0.2 mg intravenously over 15 to 30 seconds. If the response is inadequate after 30 seconds, administer 0.3 mg over 30 seconds 1 minute later. If response is still inadequate, repeated dose of 0.5 mg can be given over 30 seconds at 1 minute intervals to a maximum cumulative dose of 3 mg per hour. That is it for today's class. Do consider to go through the materials again and try to fill in this table. Click on the link here to revise some other drugs discussed in our first video. As always, if you find this video helpful, do not forget to click the like button and share it. See you in the next video. Have a great week.